I'm Brenda Kurt-Wright. Welcome to my channel where I talk about cognitive rehabilitation. I'm a speech-language pathologist, and today I'm talking about one of the dementias. It is called Frontotemporal Dementia. It is also known as FTD. It has been in the news recently because Bruce Willis has been diagnosed with it. It is when the neurons in the brain are damaged in the frontotemporal areas of the brain, so the front and the sides of the brain. It occurs in people ages 45 to 64 mostly in terms of the diagnosis, so a younger group than other dementias, and it does progress over time. The longevity is not pinpointed, but some research shows that the longevity is from approximately 2 to 10 years. The diagnosis can be rendered by a variety of places. A lot of the places are universities, and that's because they provide a more thorough team of experts who are under one roof, who would be able to provide input on the characteristics and the testing that is required. And so I provided a list of places in the link below that would be helpful to at least begin the search, but I'm sure that there are more places that are able to do the testing. So you will see many of the places are your traditional Mayo Clinic, Columbia-Presbyterian Medical Center, Johns Hopkins University School of Medicine. And so there's a list that is mostly associated with universities, but again, there are probably other medical professional clinics that are even possibly in the city or state where you live that are able to provide that type of testing. I want to talk about treatment. So I'm going to be speaking of the variant, the language variant, which I mentioned earlier is known as PPA, and that stands for Primary Progressive Aphasia. There are your typical language therapies provided by speech-language pathologists that would be helpful and proven to be effective in research, including type of interventions that would focus on word retrieval, phonological treatments, functional training of pictures that the patient would label to help with language recall. Also, sentence completion exercises where a patient would identify if a verb or a noun goes into that place, supplemental written training for people who would benefit from writing the information in addition to producing a word. They might do a better job if they are actually writing the information out. Also, for people who are more nonverbal, we would recommend script training where they would learn how to remember a script or use a visual cue of using a script to help them know what to say in a certain situation. Also, compensatory strategies would be very helpful, just helping someone to even know how to use gestures. Person-centered care would be recommended, where instead of using a standardized test to develop a goal that perhaps the speech pathologist would recommend, we would sit down with the patient, determine what is important to them in their life, in addition to their family member, to figure out what goal that they really want to work on. If somebody has one particular thing or multiple things, we can help remediate the problem and help them practice how to improve in that area. There is more research being done in the area of PPA. There are clinical trials to help figure out treatments, including medication and treatments that can work to help reduce symptoms, such as, like I was talking about, the language interventions that I would do, or that would be a speech pathologist would do, just trying to figure out what treatments are available to even people who have the more behavioral type variant, because there is a behavioral variant of FTD. And so just trying to figure out how to work with that to help reduce behaviors, such as things like apathy, or emotional problems. So it would be good to know if you have FTD or someone you know has it, to refer them to the list of clinical trials, which is listed. I've included below. I've included it here. And it is something that would be valuable, and it changes over time. So that's something by the Alzheimer's.gov website has a clinical trials, basically finder, where you could see who's doing clinical trials on that type of dementia. And so another good reference is the Association of Frontotemporal Degeneration, which has a website and a phone number, but it helps people you can call and ask questions about FTD. You can obtain information about caregiver support. There are support groups that they have a list, and where you can find support groups specifically for something like PPA. And that is something that could also help caregivers. So it's not just for the patient with FTD, but also for caregivers. They even have grants that can help people with FTD seek services or resources, financial resources to obtain services. So it's good to have that resource, and I've included that in the link below. That's an overview of FTD, talking specifically about PPA, Primary Progressive Aphasia. And I hope that this information is something that you find valuable. And if it is, let me know that this is something that you feel has been helpful. And also share this with someone who you might think could benefit from this information. And other than that, I'd like to thank you for joining. If you find this helpful, please subscribe to my channel, and we'd love to have you here. I am attempting to build a community of people who are very interested in this topic, cognition and cognitive rehabilitation. So thank you very much for joining today. I look forward to future connections. Have a good day.